We're going to talk about Alpha-1. A follower requested this. It's a genetic disease, and it's only a genetic disease. The long term for it is Alpha-1 antitrypsin deficiency. It's a genetic disorder causing low levels of AAT, which is a protein that actually protects your lungs. People of European descent have the highest risk of getting this. In fact, it's very common. It's the most common genetic disorder in that group of people. 1 in 25 will actually have it. If you're not from European descent, it would be very rare that you would have it. Without enough AAT in the lungs, you're going to be more prone to develop certain conditions like COPD or emphysema, and have issues like pneumonia, chronic cold, getting colds chronically where you're not able to fight them off. That also with the AAT, you will also be at risk for having cirrhosis of the liver, as well as a skin disorder called paniculitis. What happens is the AAT, genetically, you will either have low amounts of AAT or no AAT. It's produced in the liver and is transferred to the lungs. So the other thing that can happen with the genetic malformation is your AAT may be supposed to be in a certain shape. However, due to your genetic mutation, it's in another shape. So instead of being able to be transported to the lungs as it should, it is stuck in the liver. And the excess amount of AAT in the liver is what leads to the scarring of the liver or the cirrhosis. And that's the issue there. AAT is a protein that helps shut off a certain enzyme called neutrophil elastase. Neutrophil elastase is important because it fights off lung infections. The bad thing is it doesn't know when to stop. So once it fights off that lung infection, it's still hungry and it's still going and going and going. So what it then does is it eats up elastin, which is very important for your lungs to function because it gives the structural formation of the alveoli or the air sacs in your lungs that enable you to breathe. Well, if you don't have enough AAT or any AAT in the lungs, this elastase runs amok and will eat up all the elastin. Your alveoli will shrink, they will not be able to form correctly, and you will have trouble breathing, hence the emphysema and COPD. Symptoms of having enough AAT, not having enough AAT in the lungs where you're having respiratory issues include frequent colds, fatigue, shortness of breath, wheezing, chronic cough. That mainly is going to occur in adults over the age of 30. Now, the liver is a separate issue. You're generally going to see that in kids and, of course, progress as you go. With the cirrhosis of the liver, what you're going to see is yellowing of the skin and the eyes, itchiness, throwing up blood. Any of that occurs, you need to get to the provider right away so they can start looking into that. Now, as far as treatment, the good news is if you have alpha A, it's not going to cut your life short as long as you take care of yourself. But with treatment, they can do AAT supplementation from blood donors IV. They also can use inhaled bronchodilators and corticosteroids. So drugs like Advair, Symbicort, Flovent, things like that. You can also, if you get to the point where your lung function's not good, pulmonary rehab is a very good thing, as well as supplemental oxygen. Now, things that you can do to help yourself out. First and foremost, stop smoking, vaping, anything like that. Secondly, don't drink any alcohol. Avoid lung irritants. So if you're Painting, you want to avoid that. You don't want to be doing that. If you're out in a dusty situation, like a farmer or rancher, you want to avoid that as much as possible. Get a very high strength mask to help you out if you have to do it. Avoid Tylenol. Exercise as much as you can. And again, that's where pulmonary rehab comes in. Get your vaccines, very important for flu and pneumonia. And then, if you do have this, get your family genetic tested so you can see what lies ahead before you're dealing with it at the point of nothing can be done.